Market Justice versus Social Justice by Robin Stafford. Market justice. The definition of market justice is fair distribution of health care to the market forces in a free economy. Market justice, also known as the economic good, is governed by free market forces and requires no interference from government. This theory of justice causes those who cannot afford health insurance to have limited access to health care, rationing by ability to pay. Market justice sets the rates of healthcare insurance based upon what services are desired and how much the individual is able to buy at the existing price. Social justice. Social justice is defined as the equal distribution of resources and opportunities in which outside factors that categorize people are irrelevant. Social justice, also known as the good society, believes that healthcare is a social good and should be provided and distributed by the government. This theory also believes that health is a shared responsibility, meaning that due to what is around them, they should not be held responsible for the high costs of healthcare. Major differences between market justice and social justice. Market justice is ran by free market sources, does not always protect the society, does not address concerns such as homelessness, illiteracy, and poverty, and does not work well in healthcare delivery. Social justice is ran by government, considers healthcare as a society's responsibility. Healthcare is a necessity and does not require the individual to be able to afford it, and collectively financed and available to all. Social justice, how it would benefit the U.S. healthcare insurance system. If our country, the United States of America, were to use the social justice theory, the quality of our country would greatly improve. There are too many citizens that desperately need healthcare but cannot afford its high cost. By the government looking at us as a whole instead of individually, crime is more likely to decrease, illness will decrease, and people in general will be happy and feel more equal. If a national health system were put in place for U.S. citizens, not only would everyone have healthcare coverage, but there would be more money put into the economy as well. Most families are spending half of their income for healthcare coverage that is barely used. The monies that would be normally used for coverage would then be able to be used for other purposes. Also, employers may be able to increase wages due to the employees receiving coverage outside of the workplace. There are many ways that the country could benefit from transitioning into a social justice system.